Welcome to today's explainer. Get ready because we are embarking on a truly fascinating medical detective story today. We're looking at oral leukoplakia, a precursor to mouth cancer that literally hides in plain sight. In this explainer, we're going to uncover the hidden root causes of this condition by blending cutting-edge modern diagnostics with ancient wisdom. It's a journey that'll completely change how you look at your own oral health. Let's get into it.
Okay, let's dive into this. Imagine you're just looking in the mirror, brushing your teeth, and you spot a white patch inside your mouth. I mean, most of us would probably just brush it off, right? Maybe assume it's a minor irritation from a sharp chip or something. But you gotta ask yourself, is it just a temporary nuisance, or could it actually be a critical warning sign from your body? Understanding the true nature of this completely ordinary-looking spot is basically step 1 in our investigation.
Section 1. 内部の警告 sign, the warning sign inside. Identifying leukoplakia.
So let's establish our primary clue here. We're not talking about everyday mouth ulcers or canker sores. We're specifically looking for white patches that pop up right on the boundary between your gums and teeth, or maybe up on the hard palate, the roof of your mouth. And here's the absolutely crucial difference. A lot of people see a white tongue and completely panic, but usually that's just a fungal overgrowth like candida. If you take a soft toothbrush and give it a gentle scrub, candida wipes right off. But leukoplakia? It's a stubborn, plaque-like lesion. Even with scrubbing, it simply refuses to budge. So if you've got a white spot that won't wipe away, well, you've established the baseline for leukoplakia.
Now, you might be wondering, okay, how dangerous is this really? Well, it turns out perspective totally changes the data. If you look at the stats from a general dentist or GP's office, the chance of this white patch turning into a malignancy is tiny, about 0.7%. But, and this is a big but, if you look at the data coming out of specialized cancer hospitals or university centers, that malignancy rate jumps up to between 2 and 4%. That's a significant leap. The reality is, this is officially classified as a precancerous lesion, so it absolutely demands our attention. Section 2. 摩擦、それとも別の何か? Friction or something else, the conventional suspect. Let's look at our conventional suspects. In Western medicine, the standard explanation for these white patches is basically mechanical friction. The usual culprits, we're talking overbrushing with super hard bristles, maybe poorly fitting dentures that are constantly rubbing against the gums, or chemical irritants, think chewing tobacco or really heavily spiced foods. And because the focus here is mostly on that localized symptom, the standard treatment is pretty straightforward. They basically just cut it out. Doctors will typically use a scalpel or a carbon dioxide laser to remove the white patch entirely. Problem solved, right?
Well, actually, here's the major question we have to ask. Why did these white patches appear in the first place? Think of this like a giant iceberg. Laser surgery brilliantly removes the tip of the iceberg, the part we can see above the surface. But if we don't address the massive, dangerous block of ice hidden underwater, the actual underlying root cause, aren't we literally just waiting for it to grow back?
Section 3. 東洋医学のアプローチ. The Eastern medicine approach. The detective's toolkit.
Let's move to and see how this builds. Because to look beneath the surface, our source material turns to Eastern medicine. Here, a doctor acts way more like a seasoned detective. To build a complete diagnostic picture, they investigate a comprehensive 10-year patient history using 5 traditional sensory methods. Step 1 is observation, basically assessing general energy and voice volume right when you walk in. Step 2 is visual inspection, looking at skin gloss, eye clarity, and the tongue. Step 3 is smelling and hearing, checking for things like ketone breath, which can indicate blood sugar issues. Step 4 is palpation, pressing the abdomen to literally feel the rebound speed of your internal organs. And finally, step 5 is meridian pressing. This is checking specific acupressure points to see if, say, pressing a point on your leg magically relieves tension in your stomach. It's all connected.
And during that visual inspection, there's this fascinating step, having the patient flip their tongue up. Surprisingly, the underside of your tongue is a literal window into your body. It's actually the only place where doctors can directly observe the state of your arteries and veins without doing some kind of invasive procedure. Bulging red arteries might point to cardiovascular stress, while dark bluish veins, they could indicate kidney or lymphatic issues. Your mouth is essentially a mirror reflecting your internal health.
Section 4. 食事、呼吸、そして感情. Diet, breath, and emotions, the hidden culprits.
Through this Eastern diagnostic lens, we find some highly unexpected root causes for gum and palate cancers. First up is diet. There's a surprisingly strong correlation with a very high intake of wheat and bread, which creates systemic imbalances over time. Next is breathing. Chronic mouth breathing constantly pulls cold air directly over the palate, and since cancer cells actually thrive in environments with lowered body temperatures, this localized cooling effect is a massive hidden risk factor. Finally, and I think this is the most surprising one, are our emotions. Specifically, emotions tied to what Eastern medicine calls the earth element. In the framework of the 5 elements, the mouth represents earth. It's fundamentally tied to how we express ourselves. When individuals harbor deep feelings of jealousy, a lingering need to be spoiled, or, and this is the big one, thoughts and desires they feel completely unable to express, that suppressed emotional energy actually manifests physically in the mouth. I really want you to reflect on that for a second. Are there things you're constantly holding back from saying? This philosophy strongly suggests that emotional suppression has a very real, very physical impact on your oral health.
Section 5. 高度なスクリーニングと発見 Advanced Screening and Detection. Modern tech meets ancient wisdom.
Now, we don't just have to rely on ancient diagnostics. We can actually pair this holistic root cause analysis with some incredible cutting-edge preventative tools. One super powerful tool is oral cytology. It's kind of similar to a pap smear. Cells are painlessly collected and classed on a scale from 1 to 5. So instead of rushing straight into surgery, a patient with a precancerous class 3B lesion could, say, cut out wheat or fix their mouth breathing, and then take another test a month later. If the cells improve to a class 3A, boom, it proves the lifestyle interventions are actually working. Unfortunately, this kind of proactive tracking often isn't covered by standard health insurance just yet, but it's a real game changer. Now, what's really interesting about this slide is another incredible piece of modern technology, the Velscope. It's a diagnostic device widely used in places like Russia that shines a very specific wavelength of blue light right into the mouth. Under this light, healthy tissue fluoresces naturally, but deep, precancerous cells, they absorb the light and appear as distinct black spots. This allows doctors to literally see cancer forming long before it ever breaks the surface as a white patch.
Section 6. 行動と予防 Take action and prevent. Your next steps.
So what can you actually do with all of this information right now? Well, here's a simple, highly practical test you can perform at home if you ever happen to notice a white spot. Step 1. Wet a clean cotton swab with some water. Step 2. Gently but firmly rub the white spot. Step 3. Just observe it for a few days. If the spot completely refuses to wipe off, don't panic, but definitely take action. Our source strongly recommends consulting an oral surgeon, preferably at a university hospital, just to get a proper, thorough evaluation.
So, the crucial point is this. Removing a symptom with a laser is sometimes necessary, sure, but it is absolutely not the same thing as healing. True prevention means digging deep. It means looking at your diet, your breathing habits, your body temperature, and even your emotional state. Treating the root cause, and not just hacking away at the symptom, is the true path to ensuring the disease doesn't simply return. I'll leave you with this final thought to ponder. Your body is incredibly smart, and it's constantly trying to communicate with you. You just have to look closely at those subtle signs. What hidden lifestyle habits or unexpressed emotions is your mouth trying to warn you about today? Listen to your body, take proactive steps, and always stay curious. Thanks so much for joining me on this explainer.